Hi, this is Dr. Paul Firnhaber. It's Wednesday and time for 10 Minutes of Truth. So glad to be with you today. I'm at Lincoln Disc and Nutrition here in Lincoln, Nebraska. Today we're going to be talking about vitamin D and cancer. And I got three articles here that I want to discuss. The first article is from the National Cancer Institute. And this is, the name of this article is Vitamin D and Cancer. And so this starts out by describing what the functions of vitamin D are in the body. So vitamin D is actually a group of fat-soluble hormones and prohormones that help the body use calcium and phosphorus to make your bones stronger. However, they do a lot of other important things in the body as well, including reducing inflammation, controlling cell growth, as well as influencing neuromuscular, immune function, and glucose or blood sugar metabolism. Now you find vitamin D naturally, you get it from sunlight. The sun converts cholesterol into vitamin D. So vitamin D is derived from cholesterol. And that's why taking statin drugs and lowering the cholesterol actually lowers vitamin D quite often. But you get it in things like fatty fish, salmon, trout, tuna, and mackerel, cod liver oil, liver, and eggs. You get it, vitamin D2 or ergocalciferol is found in some plants and some fungi, and vitamin D supplements can contain either form. So the question is, in this article, does vitamin D help with cancer? Well, it sort of depends, all right? And that's the other two articles as well. So I'm just going to quote some things out of this article that I think are important. In experimental studies of cancer cells and tumors in rodents, vitamin D has been found to have several biological activities that might slow and prevent the development of cancer, including promoting cellular differentiation, decreasing cell cancer growth, stimulating cell death, which is called apoptosis, reducing tumor blood vessel formation, angiogenesis, and decreasing tumor progression and metastasis. Vitamin D was also found to suppress a type of immune cell that normally prevents the immune system from responding strongly to cancer. So, what are the risks of, if you take vitamin D, does it actually help reduce cancer? Well, again, that depends. According to this article, higher vitamin D levels have been consistently associated with reduced risks of colorectal cancer and, to a lesser extent, bladder cancer. Studies have consistently shown no association between vitamin D levels and risk of breast, lung, and several other less common cancers. Now, however, it goes on to say this, is that when they looked at a meta-analysis, meaning they looked at 12 different studies and put them together, and they found a 14% higher risk of cancer mortality among people with the lowest vitamin D level concentration in their blood. Similarly, an analysis of approximately 4,000 cancer cases within the prostate, lung, colorectal, ovarian cancer screening trial found a 17% lower cancer mortality among men and women in the highest category of vitamin D levels compared to the lowest category. Then they make a bizarre statement here in the article, and I want to talk about this. It says, the early large randomized women health initiative trial found that supplementation with 400 IUs of vitamin D plus 1,000 milligrams of calcium had no effect on the incidence of breast or colorectal cancer among postmenopausal women. So I just want to just make a comment on this. This basically means nothing. First of all, 400 IUs of vitamin D per day It's an extremely low dosage. It's not a therapeutic dosage. It isn't even a dosage high enough to really get you past vitamin D deficiency. So this would mean nothing. Another thing is they looked at 1,000 milligrams of calcium, but what form of calcium? Most of the calcium that's used in these trials is calcium carbonate, which is almost unusable by the human body. So here's an extremely low level of vitamin D, 1,000 milligrams of calcium, which is most likely calcium carbonate. This doesn't mean really anything. I don't even know why they would put that in there. So let's look at a few other things. I want to look at another article. This is an article in a journal called Endocrine Connections. This is December of 2018. The name of the article is Circulating Vitamin D Levels in Mortality in Prostate Cancer Patients, a dose-response meta-analysis. So they looked at 7 studies with 7,800 participants. The results indicated that higher vitamin D levels could reduce the risk of death among prostate cancer patients, and they were even able to quantify it. It says this meta-analysis suggests that higher 25-hydroxy vitamin D levels were associated with a reduction of mortality in prostate cancer patients, and vitamin D is an important protective factor in the progression and prognosis of prostate cancer. Very interesting. There's another article. Effective vitamin D. This is in the Journal of the American Medical Association 2020. It's effective vitamin D3 supplements on development of advanced cancer, a secondary analysis of the VITAL randomized clinical trial. So here they were looking at 2,000 IUs per day of vitamin D3, and they were also giving 1 gram a day of omega-3 fatty acid supplements. So to me, that kind of confuses it a little bit because, what's causing what here? So what they found in this study was that, and they also looked at the body mass index of the patients that were getting this. And what they found when looking at body mass index and vitamin D supplementation, even though they weren't giving a lot of vitamin D, 2,000 IUs a day is not a lot, they found out that people with a normal body mass index responded much more powerfully to vitamin D supplementation than people with a higher body mass index. In fact, they were able to look at it, and the higher or the fatter the person got, the less vitamin D was protective in terms of cancer. And so I just want to make a few comments on these studies. First of all, I think they're very interesting, and they do show that vitamin D can be an important factor in reducing the severity of different cancers. It also shows that there's other factors involved. For example, a thin person or a person with normal body mass index is much more likely to have a normal insulin level. We know that high insulin drives cancer. We know that's a scientific fact. And so there's other factors involved. For example, if you're running a very high insulin level and you're taking a lot of vitamin D, your chances of that vitamin D being protective or extending your life are way less. And so my recommendation is, I think vitamin D supplementation, especially, if you're low in vitamin D, is really, really important. But so is keeping your serum insulin levels low and your body weight normal. Now, one other thing that I want to mention here that I think is really important, and this was not in the articles, but it's something that I'm well aware of since I do blood work in the office, is that if your liver is toxic, you have a toxic fatty liver. Sometimes it doesn't even have to be very toxic, sometimes mildly toxic. That will prevent you from assimilating and utilizing vitamin D. So sometimes it's a matter of cleaning up your liver. And in some of these obese people in these studies, probably a lot of them had fatty liver problems, and that may have been one of the reasons why the vitamin D didn't work as well. So when I do a comprehensive blood panel, I look at things like that. I look at, how's the liver working? I do a lot of different markers that show liver function and whether that liver is functioning properly, whether they have inflammation, whether they have a fatty liver. If they do, and the vitamin D is low, we really need to get that liver working better in order to absorb and utilize the vitamin D. So there's a lot of different factors going on in human health. Vitamin D is important, but it certainly isn't the only factor. And as most of you know, this month we're doing a blood work special here in the office. Comprehensive blood panel plus a lot of extra markers. And if you're interested in doing that, you should call Carmen at 402-488-2220, and she can explain the process, the costs, and what's involved. It's a great deal. You get a lot of good information about your metabolism and what's going on in your body. And then I show you strategies to fix that. So if you're interested in that, call our office. In the meantime, great being with you again on this Wednesday. Look forward to seeing you again next Wednesday for another 10 minutes of truth.